who is going to be discussing with us COVID-19 mitigation for both miners and those mining communities as a whole. So, Fredrik, if you would like to unmute yourself, and if you have slides to share, now is your opportunity to start sharing them, because the baton of power will pass across to you. And over to yourself, sir. Thank you very much.
Sarah, thank you so much. And to the other Sarah, thank you for this fascinating presentation that you just gave. Really, that was very interesting. I only joined at the end, but that was fascinating. So this extraordinary conference that you've put together, thank you so much, Sarah and Rose, for inviting me to be part of this experience. And remarkable to see that a number of people are indeed taking part, and I'm sure the resource that you're creating through this is also going to be an extremely useful one. So just a few words of introduction from me first about True Footprint. We are a Cambridge, UK-based company that works on producing ESG, sustainability and impact data, and better results, and working with a range of institutions, from asset managers to companies and local communities in that process. And just a bit of research that we did last year in the mining industry, which is one of our focus areas, we found that of their non-financial reporting, and just minimize this, of the non-financial reporting, 70% of material indicators used were of input and output indicators. And 26% were outcome indicators, meaning only 4% were impact indicators. So that is in their non-financial, in the sustainability reporting. And why does that matter? It matters because without any consistent focus on outcomes, it's very difficult to know what we're actually achieving. So what we do in True Footprint is we help to capture outcome data. And I just gave here an example from what COVID-19 type work could look like. So an input is capital, technology, nature, is natural resources, is $100,000 for COVID-19 relief. The outputs would be what was spent on that, and it could be the goods purchased, the training provided, publicity materials disseminated or posted, etc. But what we need to know is whether that stuff is available, right? Is it actually being used? Is it accessible? And is that which was donated, did it not just arrive on site, but is it actually in use 3 months later, 6 months later? Because only then can we capture the impacts that we want to achieve. And that's what we help to do at True Footprint, is to capture outcome data, both top down at the corporate and the asset levels, and then bottom up through and from the workers and the communities where the mining takes place. Now, some mining takes place in very remote areas, and there are hardly any communities to speak of. But in many other areas, indeed, there are communities there, and there is, of course, the case of artisanal mining as well. Now, how does this then relate to the situation of COVID-19? So the mining industry has a long history of needing to address health issues, right? And whether it is airborne diseases that cause long-term health effects like cancer, hearing loss, and obviously physical impairments, deaths, serious injuries from mining. And in more recent decades, the big concerns around tuberculosis, HIV/AIDS, and malaria. And so the history is a long one of the mining industry having to engage with health. This is nothing new. But where with COVID-19, first of all, we have a global pandemic. We have a transmittable disease. And we have a disease where the contours of it are not well known. We don't know what's going to happen with it. We also know that it's, of course, not sufficient to curb it within the mine and among the workers if the community surrounding it, the families of the workers, etc., continue to be affected. And so if we draw on some past experiences, we know that among the risks that can occur, especially in countries with the most fragile health systems, are that some populations are going to be at particular risk, and that there's going to be groups of people who are severely exposed. We know that this virus does discriminate. And the risks in countries with fragile health systems include misallocated resources and health equipment. So in the Ebola crisis, 1/3 of the Ministry of Health's budget in Sierra Leone disappeared, was unaccounted for. We know that PPE might not get to where the authorities think it's meant to get. And in the extreme cases, you can have ghost workers and even ghost hospitals. So in the Ebola crisis, again, in 2014-15, there were at a minimum an estimated 6,000 ghost health workers in Liberia and Sierra Leone. Health workers who only existed on paper. Now, clearly you can't fight Ebola any more than at COVID-19 with people who exist only on paper. And so the proposition is that if we could have better quality of data on what is not being spent and raised, but what is actually accessible and available on the ground, this would help a great deal for both health workers and eventually also the mining companies. And the only way to do this in a realistic manner is actually to engage health workers and the at-risk populations and the communities themselves. So this is in the spirit of what we do in our day-to-day work. This is simply an adaptation of our core, one of our core tools. We call it the True Footprint Field App, which is, as I said, driven by people on the ground. And it's only the people on the ground who can really tell us what is happening. And you can't rely simply on the ministries of health or on healthcare workers or on people on their own. But by triangulating this, we should have a good idea of what is happening. So the app is very simple, takes you through various steps, and it allows us then to do a mapping. Sorry, there's something that's gone wrong with the graphics here, but it allows you to do a mapping of where certain issues then have arisen. And so we have we are now actively exploring actually with mining companies, but we have a fairly significant group of NGOs and the Global Fund to Fight AIDS, TB, malaria as a partner in this effort. And so several of the NGOs we're working with are in countries where there is significant mining taking place. And we're hopeful of being able to engage some of the mining communities and mining companies in that process. And with a twofold view to this, really. So in the first instance, simply providing far better insights into what is happening around the accessibility of safe medical care and regular medical care in these areas. But for those who are not already convinced of this, also introducing the notion that actually communities are one of the best sources of verification of what is going on the ground if you put the right tools in their hands. They ultimately need to be the owners of those outcomes, right? If they don't care about functioning roads, education, access to water, and functioning health services, then we have a basic problem, right? And the proposition is that they need to be the drivers of the change, the owners of the outcome, and therefore also the producers of the data. I think my time is up. So I just wanted to introduce this concept to you of really community-driven data production and the verification of outputs and the production of outcome data at the community level, and the triangulation through health workers, but also from local communities. They have to ultimately be the owners of what's meant to benefit.
Brilliant. Thank you so much, Fredrik. I think that was a fantastic talk and actually builds on really nicely from what we've been hearing earlier on today, especially with regards to trying to look at the real impact of what some of these initiatives, for example, might be aiming at as a whole. Just with regards to some of the questions that are coming through from us here that we have on the Q&A and on the chat, it was unfortunate, I think, that we maybe couldn't see your maps in all their great detail. Would you be able to just, summarize where are some of the areas where people have got larger problems, or perhaps they are missing out on equipment, etc.? Would you be able to describe what some of the summaries are from the maps that we couldn't quite see?
Okay, Sarah, we're really early days with this, but I was talking just the other day with a doctor working with a large French company that's going to donate some very serious equipment in various African countries. They cost tens of thousands of dollars a piece. Mm-hmm. And he got it immediately that, it's not just a question of verifying whether the equipment arrives in the hospitals. But is it still there 2 weeks later? Is it still there 2-3 months later? 6 months later, right? Because it's all well and good if it arrives, but what if the senior doctor then removes it and takes it to his private clinic, or indeed sometimes even sells it? And so what we are mapping and seeing is that ability of engaging the people who care the most about this. Who cares more about this than the communities on the ground? Then mothers of children, daughters of elderly people, right, who are concerned about what's happening. No one cares more about them or the local healthcare worker. And so it's simply a question of empowering them to be part of this. But it's not enough to just report problems. So it's very easy to just do that. What we do with our application is also to capture where and how problems are being solved. Because that's where the real gold dust is, if I can use a mixed metaphor, is that's where we are able to capture the innovations that people are creating, right? And then learning can happen as a result of that. If you only report problems, it can actually be very frustrating, because it is only ever one part of the picture, and problem reporting on its own doesn't lead to problem solving. So what we emphasize is the fact that people have to be part of the problem-solving process themselves.
So with that then, Fredrik, have you got any really good news stories where you're seeing some of those solutions coming through and really working, or is it too early with regards to COVID-19?
I'm afraid it's a bit too early, yeah.
Okay, so then just to spin that, and I mean, one of the regions that we've been talking about a little bit today has been that southern region within the Democratic Republic of Congo, where of course a lot of the world's cobalt, for example, comes from. So if we take Kolwezi, where there are lots of mines around that area, and I think as of today, they have yet to report a confirmed case of COVID-19, whereas 100 kilometers away in Lubumbashi, actually there are a number of cases that have been confirmed there. If you were working in the Kolwezi area at this precise second in time, what would you be doing to try and make sure that that community is prepared for what has the potential to be coming through their door very, very soon?
Well, so the power of this approach, thanks a lot for that question, and we're not there, but I'm very hopeful that we might be able to do so, is, with track and trace apps, you need a lot of people to sign up for them, because otherwise it just doesn't work, right? It's all about the numbers. Here, it's actually not all about the numbers. It's about local existing networks. So if we, for example, were able to mobilize, I don't know, Caritas, or even a handful of locally existing NGOs that have their existing networks, we don't need very large numbers of people to make us well aware of what is the state of affairs in the various health centers, right? Simply to do the systematic work. But the point is that it's not enough to just do it at one point in time. The real value comes from doing it on a continuous basis, right? And so when that mining company makes a donation, and some of them have been making large donations, you want to make sure that it arrives, that it's in use, and that it continues to be accessible, right? And that's how we know then that the system is resilient, because at that point, we know that the healthcare system at the local level, even in the most basic form, is actually pretty well equipped to deal with it. After all, in Congo, right, they have had years of the Ebola crisis. So they know very well, actually, some of the things they need to do. And it's the co-discoverer of the Ebola virus, this Congolese doctor whose name escapes me at the moment, I'm sorry to say, but he is the one who makes the point, is that social engagement, community engagement is the first line of defense. It's not medical doctors going out there. It's communities engaging. That is the first line of defense. Yeah? Now, for that, it means networks. It means people who know each other. You can't build community engagement overnight. So you need to draw on existing networks.
Well, I mean, I think that's absolutely fantastic, Fredrik. And I think thank you so much for sharing this with all of us. And my final question for you would be, so, you know, so for example, we're talking here about, say, the DRC. Does this work just as well in somewhere like the UK, where perhaps people are trying to get used to a new normal, or, you know, whatever the case might be? So does it work just as well somewhere like here, where we're sitting right now? Or some of us are sitting right now, I should say.
I love your question, and our commitment is absolutely to that. And you know, this is, you know, this unique experience we're all going through. But we have an inquiry from San Mateo County in the US, a very specific location there. But with our partners, yes, this is actually going to be deployed in a couple of, more than a couple of OECD countries as well.
Brilliant. Well, that is really good to hear, because I think perhaps as one of the mere members of the global population, we need all the help we can get. So thank you very, very much, sir. And we're all putting our hands together for you behind our muted microphone. So thank you very, very, very much. That's brilliant.